There's 3 parts to the community development course: asset mapping, best practice worldwide, and the actual project itself. The first part of the community development was an asset mapping of what Banbridge had in the community. We then moved on to look at co-productions and stakeholders, and what was the strengths and the weaknesses in Banbridge, and looking at what the strengths and weaknesses were in the GP surgeries. The need that was missing was children's attendance at school, or anxiety levels in school being increased. In the GP surgery, myself and a colleague had a lot of young people coming in with anxiety. It started off looking at the numbers of kids that were presenting with anxiety. So I went to our primary school then. The school invited me in to use their safe space. We had 10 children that they had identified in P7s. Now the children are understanding. I have some of the children coming back to me. This is their 4th time because of the enjoyment they had out of it. Some of them have moved on to secondary school. It's been quite successful, the transition, for their concentration. And the teachers have taken on board some of the yoga stances that we use. There's different things that the school have taken on board, and I've found it very useful. The parents are now saying how relaxed they are, how chilled they are. The teachers have seen them being more settled in the classroom situation. It takes them into a space of relaxation. I struggled at the beginning of the course with the new technology and the way of researching. That wouldn't be something that I would be used with either. But then I began to relax after Christmas, work forward to it, because it's bite-sized, it's easy managed. You have support within the classroom from other colleagues. It is true social work, grassroots, living the dream. The GPs are so helpful, really on board with whatever we do. It's changed my thought process on what a community is. I see it as very enriching for a community and empowering people in a different way than a medical way. No matter what part of social work you do, community is what helps people. The Newry Federation have taken on a lot of new roles from their training, like chatty benches, the Wool Crew. It's just massive what we can do with only 13 social workers in the current GP Federation. The course and the yoga has actually supported me with one particular young lad. He said to me that he was having problems at home. I was able, through the GP practice, to go back to his mummy and advocate on his behalf. The word is spreading in Banbridge that the social worker, what it can do on behalf of the GP. Communication skills has changed in the GP world, because you have to remind the GPs that you're not talking medically, communicating to the variety of ages and even down to the admin staff. The course has improved my leadership skills because I'm working in a different way. I'm working with 25,000 patients in Banbridge, so I have to then have a different style of leadership, and the course has helped me with that. 42 years I worked with young people under 18. Now I have to use a different style of communication, so it's changed the variety of my communication skills to different age groups as well. I love my job, and this has given me a different insight, because I see it so empowering to people, and such a vast number of people as well. The course has motivated me because it actually shows me if I work with the community of people, they then can build on that, and I can step back and let the community work do its best job. With different community projects, we can help lots more people. Doing the current course has influenced me in a whole lot of ways. It increases my knowledge and skills, and I take that back to the GPs, or take it back to the practice managers or the patients. We have physiotherapists and pharmacists and primary mental health. I also empower them with information of community work, because then they can guide their patients into different group work situations in the community. Empowered me to see communities in a different light, to see them in such richness, whether it's a housing estate or it is in the GPs or it's a primary school. I just see the richness that a gathering of people can bring, and how they can then change lives in so many ways. I thought I would have know everything, but the community development has enriched me with so much knowledge and skills.